Welcome to today's Marketplace. I'm Elizabeth Hart at the NASDAQ. Today we're joined by the Chief Medical Officer for Arcellx, Dr. Christopher Heery, and Dr. Jessica Clark, Dean of the College of Nursing at Creighton University. Welcome. So great to have both of you.
Thanks for having us.
So I don't think a lot of people know this, but March is Multiple Myeloma Awareness Month. So we're going to dig into that a little bit today. And Jessica, can you tell us what exactly multiple myeloma is and what the treatments are?
Sure. So multiple myeloma is actually a cancer that affects plasma cells. And plasma cells are actually white blood cells that help us produce antibodies in our blood.
Okay.
And so what happens with multiple myeloma is those cancerous plasma cells start to aggregate actually in the bone marrow. And then that's what causes a wide variety of symptoms, anything from fever to bone pain in our patients. And so in 2017, we actually had a huge therapeutic advancement with the FDA approval of what's called CAR therapy.
Okay.
That stands for chimeric antigen receptor T cell therapy.
Okay.
And this was first approved for the use in acute lymphoblastic leukemia.
Okay, so we've heard a lot about it. It's been in the headlines, this CAR T therapy. Is it something that has been approved for multiple myeloma?
Yes, so actually in March of 2021, it was approved for the use in treatment of multiple myeloma. And then subsequently, it's been approved multiple times, and most recently in March of 2024 for additional treatment of blood cancers.
Well, that's great to hear. We're moving forward. Okay, Dr. Heery, your company focuses exclusively on this type of cell therapy. Is that correct?
Yeah, that's right. Arcellx was actually founded with the idea of trying to make a better version of CAR T cells.
Okay.
CAR T cells, just to give a little bit of background, are individually made therapeutics for each patient. So what we do is take the T cells from a patient, and we do that through a special process called apheresis. We connect a patient to a machine that filters the blood and takes these T cells out. We ship those to another facility where we genetically modify them so that they can express a receptor so they can recognize cancer cells and kill them. Then they're tested to make sure that they're safe to give back to the patient and that they're going to work. And then we ship them back to where the patient is so that they can receive them for treatment.
Okay, so you're actually starting with a product that comes from the patient's body.
That's right.
Okay.
Yeah, each one is individually made.
Okay, so there have been some issues associated with this, and you're researching some of those.
Yeah, that's right. So CAR T cells, you know, they're fantastic therapies. Really, we could almost describe them as science fiction 30 years ago. Being able to do what we do now is not something that really medical science was capable of doing that long ago. But over the last few years, we've seen many of these be approved. Unfortunately, they still are not widely available to patients and readily available. So one of the things that we did at Arcellx was tried to make a better version of these that was more easily manufacturable and ideally would have a better safety profile. So our lead asset, which we call anito-cel, we have in clinical trials now, and it looks like it may be as good as any therapeutic we've seen in myeloma in terms of killing the plasma cells that cause myeloma. But the safety profile looks very, very promising. We haven't had some of the serious toxicities we've sometimes seen with these therapies, including what are called delayed neurotoxicity events. And the incidence of some of the more common adverse events like cytokine release syndrome and these confusion states that patients will sometimes have are less frequent than we've seen with other CAR Ts. Maybe most importantly, we've partnered this program with a worldwide leader in making CAR T cells. That's a company called Kite. Kite is part of Gilead's family of companies. And Kite is actually one of the first companies that had a CAR T cell approved in 2017. Since that time, they've become the best in the world at manufacturing CAR T cells. And so we've partnered this program in hopes of being able to deliver more CAR T cells to more patients everywhere, all over the world.
Okay, I want to go back for just a moment because you mentioned there was an issue with the availability of patients being able to access this treatment. Why is that?
Well, you know, manufacturing these things is not simple. It is a complicated process, and it requires intensive hands-on labor. There's also quality control issues, there's supply chain issues, things like that. And so, you know, I think one of the other issues is also that we've learned over the last, 5 years or so that trying to capture patients earlier in their treatment course actually increases the probability that we can use these therapies.
Okay.
The reason for that is multifactorial, but really it's most important to understand that when patients get later in their disease, they tend to be a bit sicker and their T cells aren't as happy. And so we can't make the right product for them as easily. Additionally, when we give those cells back, occasionally the patients have worse adverse reactions as a result because of the increased amount of tumor they have in their body. So treating patients earlier is a big step forward. The reason that's important is that with CAR T cells, we give it one time. So the patients are treated once. And the data we're seeing in multiple myeloma with the best CAR T cell therapies is that patients can have control of their disease for longer than 2 years, sometimes 3 years, sometimes longer than that. So when you think about just the quality of life that a patient might have, not going back in for infusions over and over again, not having constant checkups, there are some real advantages to these types of therapies. And so we think it's part of our mission and our responsibility to get these therapies to patients wherever they are.
This is notable because historically the life expectancy of someone with multiple myeloma was only 5 years on the outside. So the fact that you're seeing these great results is very encouraging.
Yeah. For Multiple Myeloma Awareness Month, we should remind ourselves that 30 years ago, the overall survival at diagnosis for multiple myeloma was under 5 years. Now, with upfront therapies today, not including CAR T cells, patients are having benefit that lasts 7 years or longer. So there really has been a revolution across the board in medications for multiple myeloma. And we have a lot of shoulders of giants that we stand on to be able to achieve this for our patients, particularly some of the nonprofit organizations that support multiple myeloma. But what we all want to see is patients be cured. And to date, we don't think of multiple myeloma as a curable disease, but we hope that CAR T cells in combination with some of these other therapies may result in cures for patients with myeloma.
Dr. Heery, it feels like you've made a lot of progress towards that end result. What do you think the future is for Arcellx?
Well, we want to apply these same technologies to other indications. There are other hematologic and non-hematologic cancers where the therapeutic advances have not been nearly as great as they've been in multiple myeloma. So particularly, we have a program in acute myeloid leukemia, which is a field that has really struggled to see improvement in outcomes. We also believe that our technology, which we haven't really mentioned, is different than other CAR T companies, is the binding domain, the thing that binds to the cancer cell. We think that that technology will enable us to go after solid tumors, things like colon cancer, lung cancer, breast cancer. So over time, we hope that we can continue to build on what we've learned and help more patients everywhere.
This is such great news. Dr. Clark, the complexity of these therapies is kind of mind-blowing. As an educator, how do you make this next generation of scientists and clinicians ready to sort of embrace this and take this all to the next level?
Yeah, so I think, hitting it on the head there with education, right? So at Creighton University, we're really known for building and creating healthcare professionals. We have a wonderful School of Medicine that's doing just that. As Chris mentioned, it's important we keep building upon this really great research that keeps advancing the sciences, that keep advancing the treatments for these patients. And so at Creighton, our School of Medicine actually has a Department of Biomedical Sciences. We have a Department of Medical Immunology and Microbiology. And we're really working in the classroom, not only teaching students, but also doing research with them in the areas of biochemistry, molecular and cell biology. And all of that evidence and research is really going to help bring new innovations and continue to add on to that body of research for years to come.
And I've been to the campus and it's gorgeous. On top of all that, it's a beautiful facility.
Thank you.
Thank you both so much. This has been great information, and hopefully it will drive a better understanding of multiple myeloma. And thank you so much for your time, and thank you for your great work.
Thank you.